The thumb, connected to the trapezium, is located on one of the sides, parallel to the arm. The palm has 5 bones known as metacarpal bones, one to each of the 5 digits. Human hands contain 14 digital bones, also called phalanges, or phalanx bones, 2 in the thumb has no middle phalanx, and 3 in each of the 4 fingers. These are the distal phalanx, carrying the nail, the middle phalanx, and the proximal phalanx. Sesamoid bones are small ossified nodes embedded in the tendons to provide extra leverage and reduce pressure on the underlying tissue. Many exist around the palm at the bases of the digits. The exact number varies between different people. The articulations are interphalangeal articulations between phalangeal bones, and metacarpophalangeal joints connecting the phalanges to the metacarpal bones. Muscles. Each finger may flex and extend, abduct and adduct, and so also circumduct. Flexion is by far the strongest movement. In humans, there are 2 large muscles that produce flexion of each finger, and additional muscles that augment the movement. Each finger may move independently of the others, though the muscle bulks that move each finger may be partly blended, and the tendons may be attached to each other by a net of fibrous tissue, preventing completely free movement. Fingers do not contain muscles, other than arcuate or pili. The muscles that move the finger joints are in the palm and forearm. The long tendons that deliver motion from the forearm muscles may be observed to move under the skin at the wrist and on the back of the hand. Muscles of the fingers can be subdivided into extrinsic and intrinsic muscles. The extrinsic muscles are the long flexors and extensors. They are called extrinsic because the muscle belly is located on the forearm. The fingers have 2 long flexors, located on the underside of the forearm. They insert by tendons to the phalanges of the fingers. The deep flexor attaches to the distal phalanx, and the superficial flexor attaches to the middle phalanx. The flexors allow for the actual bending of the fingers. The thumb has 1 long flexor and a short flexor in the thenar muscle group. The human thumb also has other muscles in the thenar group, opponens and abductor brevis muscle, moving the thumb in opposition, making grasping possible. The extensors are located on the back of the forearm and are connected in a more complex way than the flexors to the dorsum of the fingers. The tendons unite with the interosseous and lumbrical muscles to form the extensor hood mechanism. The primary function of the extensors is to straighten out the digits. The thumb has 2 extensors in the forearm. The tendons of these form the anatomical snuff box. Also, the index finger and the little finger have an extra extensor, used for instance for pointing. The extensors are situated within 6 separate compartments. The first compartment contains abductor pollicis longus and extensor pollicis brevis. The second compartment contains extensors carpi radialis longus and brevis. The third compartment contains extensor pollicis longus. The extensor digitorum indicis and extensor digitatorum communis are within the fourth compartment. Extensor digiti minimi is in the fifth, and extensor carpi ulnaris is in the sixth. The intrinsic muscle groups are the thenar and hypothenar muscles, thenar referring to the thumb, hypothenar to the small finger, the dorsal and palmar interossei muscles, between the metacarpal bones, and the lumbrical muscles. The lumbricals arise from the deep flexor, and are special because they have no bony origin, and insert on the dorsal extensor hood mechanism. Aside from the genitals, the fingertips possess the highest concentration of touch receptors and thermoreceptors among all areas of the human skin, citation needed, making them extremely sensitive to temperature, pressure, vibration, texture, and moisture. Recent studies suggest fingers can feel nanoscale wrinkles on a seemingly smooth surface, a level of sensitivity not previously recorded. This makes the fingers commonly used sensory probes to ascertain properties of objects encountered in the world, making them prone to injury. The pulp of a finger is the fleshy mass on the palmar aspect of the extremity of the finger. Each finger has an orderly somatotopic representation on the cerebral cortex in the somatosensory cortex area 3B, part of area 1, and a distributed, overlapping representations in the supplementary motor area and primary motor area. The somatosensory cortex representation of the hand is a dynamic reflection of the fingers on the external hand. In syndactyly, people have a club hand of webbed, shortened fingers. However, not only are the fingers of their hands fused, but the cortical maps of their individual fingers also form a club hand. The fingers can be surgically divided to make a more useful hand. Surgeons did this at the Institute of Reconstructive Plastic Surgery in New York to a 32-year-old man with the initials OG. They touched OG's fingers before and after surgery while using MRI brain scans. Before the surgery, the fingers mapped onto his brain were fused close together. Afterward, the maps of his individual fingers did indeed separate and take the layout corresponding to a normal hand.